Yes, I.
We are live now.
Okay. So this is the code pin. And remember how we have to enter. It has to be, if you are a PG, you have to write PG, then your mobile number and the team name in three words, alphabets rather, I should say. Next slide. So this is a pan-India intercollegiate postgraduate quiz, which is done by Brain Teasers in association with Ophthalmological Society of Nagpur. And it's the Big Q in its season 3. This is the famous signature tune which we have been hearing since last 5 years. Education is, it's not just quizzing, it is not education, it's more of a fun and learning as well. So do enjoy. We have some multiple choice. So this is the season 5. Next slide. This is the edition of the Indian postgraduate quiz, which we began 3 years back for the first time in our country. Postgraduates, just not only helping in revising their subjects and becoming plus 50 marks. So here is our, and today, naturally, my co-quiz master, co-host is Dr. Shilpi, and today we are privileged to have our 3 quiz masters. So let me just once more invite everyone. So good evening, friends, and my pranam to all the mentors. The Brain Teaser teams welcomes you all to this third quarterfinal of this third season of Big Q. Brain Teaser has been an online platform for hosting quizzes for all ophthalmologists of our country since last 5 seasons, 5 years, rather, I should say. And Brain Teaser is extremely thankful now to the team of quiz masters who toil hard to make every episode a learning with fun. Today's episode, we have some new quiz masters along with few who have been associated with us in last season as well. Let me welcome Dr. Natasha Radhakrishnan, who is a professor and senior retina consultant at Amrita Institute of Medical Sciences and Research Center, Kochi. Dr. Sharmina Devi, who is an associate professor at Department of Ophthalmology, Tanjavur Medical College. And the third quiz master is Dr. Karan Bhatia, who is a cornea, cataract, and anti-segment refractive surgeon at Meerut. We will be missing him because of some urgent medical emergency, and Dr. Shilpi will be helping out with that particular section. Of course, money maketh the mayor go is an old saying, and such a mega project is never possible without a strong financial support. I'm indeed thankful to Microvision team who have been steadfast partner with this endeavor of ours since last 3 seasons. My sincere most gratitude to Mr. Ashokan, Mr. Kumar, and Mr. Navneet for their support and pushing us to start this season again. I would fail in my duties if I don't acknowledge the field force of Microvision, who made so much of efforts to practically go physically and personally to all the postgraduates across the country and get them enrolled. Smooth and flawless execution of any brain teaser platform or any online platform, all registrations, live quizzing, computing results, and other back-end work would have not been possible without the team of Numeritech, and my sincere most thanks to Mr. Sai and his team. So without much ado, shall I request Dr. Shilpi to go ahead with the format of the quiz for the sake of audience. Dr. Shilpi, back to you.
Yes, sir. So, good evening, friends. Welcome back to the quarterfinal 3. So, we'll start with the promo video from Microvision team. So now let's quickly see what is the format of today's quarterfinal. So there are total 4 quarterfinals. So 80 teams were selected for the 4 quarterfinals, 20 teams per quarterfinal. So today is the third quarterfinal. And the fourth quarterfinal will be on 24th of April at same time. So for teams, you will have to join through Kahoot and Zoom platform, but only through one email ID. The first screen is the Zoom platform for the live quizzing, as out of the 2 rounds, one round will be face to face, and that will be only for the teams. The second screen is the Kahoot for the MCQ round, and it is for, both for the audiences and the teams. So from today's quarterfinal, out of the 20 teams, 5 teams will be selected for the semifinals. And the criteria for qualifying for the semifinals is the respective marks of your quarterfinals plus the total of your best 5 preliminary rounds which you played. So now coming to the rules, the format is, like I already told, that there will be MCQs. So 3 sets of MCQs. Each set will contain 5 questions, and both the teams and the audience will play this. There will be no negative marking in this section. The rapid fire will be only for the teams, which will be face to face. And the 5 questions will be asked, which you need to answer in 30 seconds maximum. If you don't know the answer, say pass. If the time is remaining, you can attempt the question which you have passed later on. So for every correct response, you will get plus 10, while for the incorrect answer, you will get minus 5. This minus 5 will be deducted. So teams which have not qualified for the quarterfinals, or the teams which didn't qualify for today's quarterfinal, you can play as an individual member as an audience. So these are the prizes for the postgraduates in the finals. And the audience prizes are per episode, and these are the 3 prizes for the audience for each episode. So now let's check whether your Kahoot platform is working properly or not. So this is the sample question. In which year it was decided to give Bharat Ratna for the highest contribution or performance in the field of sports? Your options are A. 2011, B. 2010, C. 2013, and D. 2015. And your time starts now. Yes, the time is up. Let's see what is the answer. It's in 2013. Before that, the field of sports was not under the, they were not eligible to get the Bharat Ratna award. So with this, I hand over the screen to our first quiz master, Dr. Natasha Radhakrishnan. She is a professor and senior retina consultant with special interest in ROP and uveitis at Amrita Institute of Medical Sciences and Research Center, Kochi. Welcome you, ma'am.
Thank you. Good evening to all. It's a pleasure to be here in the Brain Teasers quiz quarterfinals. This is my second innings here, and I'm happy to be with all of you and wish you all the best.
So, ma'am, let's start.
Yes, so we'll start with the first question in the MCQ section. So, a 50-year-old woman presents with chronic scleritis, headaches, a history of branch retinal artery occlusion, and tracheomalacia. What test may further assist in the diagnosis and treatment? A. Quantitative and qualitative anti-nuclear antibody testing. B. Lumbar puncture and spinal fluid analysis. C. Urine analysis. And D. Anticyclic citrullinated antibody test. Your time starts now. Okay, time's up. And the answer is C, urine analysis. So I'm sure you've got the diagnosis as what we used to call vaginous granulomatosis, now called granulomatous polyangiitis. And it is by how does urine analysis help you? It will help you because 88% of these patients will have glomerulonephritis. All the other tests are for other conditions and not for vaginous granulomatosis. Let's go to the next question. What is the best way to minimize the incidence of brotosis after superficial temporal artery biopsy? A. Perform the biopsy close to the zygomatic arch. B. Make the incision 2.5 centimeter lateral to the lateral canthus. C. Biopsy the parietal branch of the artery. And D. Perform the biopsy below the level of the brow. Your time starts now. Okay, time's up. And the answer is to biopsy the parietal branch. The biopsying the parietal branch also has an additional benefit that you can cover the scar with your hair, because then you have to go into the scalp line to get the parietal branch. The of course, the disadvantage is that during the biopsy you will need to shave that part of the hair. Next question. Crouzon syndrome differs from Apert syndrome in that the latter is associated with what finding? A. Hypertelorism. B. Proptosis. C. Significant syndactyly. D. Inferior scleral show. Your time starts now. That one's pretty easy, I think. It is C, significant syndactyly, isn't it? That is what differentiates mainly, though you can have other features also in Aperts. Crouzon is mainly characterized by proptosis, or rather a pseudoproptosis because of the shallow orbit. Let's go to the next question. Oxidative mechanisms have been described in the etiology of diseases that are the leading causes of irreversible blindness worldwide. What characteristic of the retina makes it more vulnerable to damage from lipid peroxidation? A. High number of mitochondria in the rod inner segments. B. High levels of saturated fatty acids in the rod outer segments. C. Poor oxygen supply through the choroid. And D. Low light exposure at night. Time starts now. Again, you might know from the word oxidative mechanisms, high number of mitochondria in the rod inner segments is the answer, A. And the last question in the series, a 28-year-old female patient has 4+ guttae, visually significant corneal edema requiring surgery. During the initial intake and examination, the ophthalmologist discovers that her mother and grandmother had Fuchs endothelial dystrophy, but they have not had any symptoms or required surgery. So what is the most likely explanation for the proband's early and advanced presentation of this disease? What is the term given to it? Penetrance, A. B. Anticipation. C. Pleiotropism. D. Haploinsufficiency. Your time starts now. And the answer is B. Anticipation, when the disease occurs earlier in a generation and also more severe in the next generation. That is called anticipation. I think with that, we come to the end of the first round of the MCQs, and it's a pleasure to introduce, though he is not here today, we will introduce Dr. Karan Bhatia, cornea, cataract, anterior segment, and refractive surgeon from Meerut. As you can see, he has an impressive array of awards and even his own technique of SFIOL implantation. So it would have been good to have him here, but let's have his questions instead from someone who's very well known to us, Dr. Shilpi.
Thank you, ma'am. So we'll start with the rapid fire round. So the first team is Sitapur Throbs. Team 1.
Hello, good evening, ma'am. Are we visible and audible?
Yes, we can only see you. Your partner is not visible to us.
Ma'am, now, okay. Wait, camera is there. Now is it visible, ma'am?
Yes. Please introduce yourself.
Ma'am, I am Dr. Anubhav Singh, a third-year resident from Sitapur Eye Hospital, UP.
I'm Meghna Dikshit, third year resident, Sitapur Eye Hospital, and our mentor is Dr. Indrajit sir.
So are you ready?
Yes,
Yes, ma'am.
So you will get 30 seconds. Okay.
Yes, ma'am.
You don't know the answer, just say pass. Okay. Chalo.
Yes,
So
Yes,
let's
ma'am.
start. So your 30 seconds starts now. So the first is, what part of the conoid of stone is on the retina if only a spherical lens is used to give the clearest image?
Pass.
Damage to the Mayer loop produces what type of homogeneous visual field defect?
Pie in the sky. Pie in the sky.
What defines type 2 Duane syndrome? Poor reduction and
Pass.
Limit.
natalizumab has been most commonly associated with mental status changes and hemianopia. True or false?
Pass.
Okay. So you can attempt the last question, but you will not get the marks. Tubulointerstitial nephritis is associated with what ocular condition? That is bilateral dash uveitis.
Posterior, ma'am.
It's wrong. It's inferior. So let's see the answer. The first answer is circle of least confusion. Second, you answered right. The third is what defines type 2 Duane syndrome is poor reduction and exotrophy. Okay. And this is a true statement that natalizumab has been commonly associated with mental status changes and hemianopia. And tubulointerstitial nephritis, it causes bilateral anterior uveitis. So you answered one question and that is correct. So plus 10 you get.
Thank you.
So keep playing. We have other MCQs also for you. So team 2 is Orostars 2. Team 2.
Yes, can you see us?
Yes. So please introduce yourself.
I'm Dr. Anusha from Arvind Eye Hospital, Coimbatore. Third year postgraduate.
I'm Ruhail.
What your
Be a bit louder. Be a bit louder.
She's Anusha and I'm Ruhail.
Okay, Rohel. Okay, come closer to the mic so that your answers are heard
Arvind Eye
properly.
Hospital, Coimbatore.
And your mentor?
Are we audible, sir?
Yeah, your
Our
mentor.
mentor is
Can you
Dr.
tell us
D.
about your
Chandrasekhar,
mentor,
sir.
please?
Dr. D.
Okay,
Chandrasekhar,
okay,
sir.
fine. Best of luck. Over to you, Shilpi.
Thank you, sir.
yeah. Please come closer to the mic. Okay. So shall we
Yes.
start?
Yes, ma'am.
Yes. So your 30 seconds starts now. What is the mechanism of bone formation in thysis bulbi?
Pass.
Which visual field defect is typically associated with Leber hereditary optic neuropathy?
Pass.
The lateral muscular branch of the ophthalmic artery supplies which extraocular muscle?
Pass.
Allen Figures has the best calibration and reliability in testing visual acuity in pre-literate children. True or false?
Pass.
The greatest risk of rebleeding in traumatic hyphema occurs how long after initial injury? In days.
5 days. And true for the previous answer.
So you gave one answer that is correct. So it's 3 to 7 days basically. So 5 days we take it. Okay, rest you pass. So the first is the mechanism of bone formation is metaplasia of retinal pigment epithelium. The visual field defect is secocentral scotoma. The lateral muscular branch of the ophthalmic artery supplies superior rectus muscle. Ellen figures this statement is false and the greatest risk of rebleeding is between 3 to 7 days. So you get plus 10.
Thank you.
Yeah. So the team 3 is Morning Glory. Team 3.
Introduce yourself.
Good evening, ma'am.
Are we visible,
Are we visible, ma'am, on the screen?
Yes,
you are
yes.
visible.
Please go ahead. Be a bit louder.
My name is Dr. Pratik. I'm from JSS Medical College, third year PG.
I'm Dr. Pujita, JSS Medical College, third year PG, and our mentor is Dr. Soumya.
Okay. Best of luck.
Thank you.
So shall we start?
Yes, ma'am.
Okay. So your 30 seconds starts now. Which bifocal type results in the least amount of image jump? 36-year-old woman with a history of migraine reports seeing a trail of an image. What?
Redox phenomenon.
For a child with right severe congenital ptosis and no ipsilateral levator function, which is the most appropriate method? What?
Frontalis link.
Anomalous retinal correspondence suggests that the strabismus is long-standing. True or false?
True.
Okay. So you attempt the 5th question, but you will not get the marks. What is the most common ocular manifestation of abusive head trauma?
Personal retinopathy.
Okay. See. So let's see the answer. The first is executive bifocals. The second is illusionary pelinopsia. And for the child, it is yes, you answered correct. It is frontalis suspension. Fourth is true statement. And the fifth is the most common ocular manifestation is retinal hemorrhages. So you answered 2 correct. Okay, so plus 20.
Well
Thank
played.
you.
So team 4, Ahan Pooja.
Hello, are we visible, ma'am?
Yes, we can hear you. Introduce yourself.
Good evening, sir. This is me, Dr. Ahan from JIPMER, second year PG resident.
And I'm Pooja from JIPMER, second year resident, and our mentor is Dr. Nirupama Kasturi.
Okay. Best of luck.
Thank you,
Are
sir.
Yes, are you ready?
Yes, ma'am.
Yes. So, okay, your 30 seconds starts now. 12-year-old boy is diagnosed with well-controlled intermittent exotropia.
Pass.
In benign essential blepharospasm, where is the central nervous system is the 7th nerve hyperactivity.
Pass.
In right gaze, the innervation of the right lateral rectus muscle will increase. Which law is this?
Herring's law.
Effect of silicon oil and power of biconvex intraocular lens. The power will
False.
The last question, at approximately what age will the baby's lacrimal gland be fully develop?
Don't know.
Okay. So let's see what are the answers. So the first answer is the stereopsis will be excellent. In benign essential blepharospasm, the activity is thought to originate from basal ganglia. The law is Sherrington's law, not the Herring's law. Yes, the fourth answer is correct. This statement is false. And the lacrimal gland is fully developed by 6 weeks. So you answer 1 correct, 1 wrong. So it's plus 5.
Okay, thank you.
First one I knew.
5.
Sherrington.
Team 5 is Team Jishnu.
Hello, ma'am. Are we visible and audible?
Yes, both of you. Be a bit louder.
Yeah. My name is Anirudh Helur, and I am Dr. Parth Palan, and we are from LV Prasad Eye Institute, Hyderabad.
Why do I see only one person in a frame?
No.
Yeah, now better. Good.
Who is your mentor?
Dr. Anubha Rathi.
So are you ready?
Yes, absolutely.
Okay. So here starts your 30 seconds. What is the predominant cell type found in
Pass,
Delhi?
pass, pass,
What term describes an oscillating eye movement characterized
pass,
by early ocular manifestation of SJ syndrome? Is which
pass,
kind of conjunctivitis? Diffuse infiltrating pattern of retinoblastoma
pass,
is what you said?
pass, pass.
A child with Sturge-Weber syndrome is at highest risk of developing rash intraocular complication during glaucoma surgery.
Fourth is false.
Okay, and the last one is
Suprachoroidal hemorrhage.
okay. So let's see what are the answers. So the first is that predominant cell type is histiocytes. So the term which describes an oscillating eye movement is voluntary flutter. The earliest ocular manifestation is mucopurulent conjunctivitis. The statement is true, not false. And the child with Sturge-Weber, yes, the common complication is choroidal hemorrhage. So you answer one correct and one wrong. So it makes to 5 plus 5 for the team.
Well played. Okay.
So team 6, Nano Wale. I like the name.
Introduce yourself and tell what is नैनो वाले. क्यों नैनो वाले? किसके नैन?
Good evening, sir.
Louder.
Be louder, please.
Hello.
Go ahead.
Sir. Good evening, sir. Sir, I am Dr. Ritika, second year DNB resident from SNC Chitrakoot.
I am Pranjal Gupta, third year DNB resident from SNC Chitrakoot.
Okay. And नैनो वाले क्यों नाम किया भाई?
Ophthalmologist से.
अच्छा ठीक है. Taken.
नैन वाले.
Well done. Good.
Okay. Chalo. So are you ready?
Yes, yes.
So your 30 seconds starts now. Which electrophysiologic test is abnormal in Azure?
Pass.
When a beam of white light passes through a prism, it is dispersed into a spectrum of colors. Which color of visible light is deflected the most?
Violet.
In patients with aniridia, what is the most common cause of progressive corneal scarring?
Corneal decomposition.
Antinuclear antibodies are the best way to determine etiology of anterior uveitis in a child. True or false?
True.
Last you can attempt, but you will not get the marks. A 6-week-old boy with clear but increased corneal diameter and IOP of 38 millimeters of mercury. What is the preferred initial treatment?
Pass.
Okay. So let's see what are the answers. The first is multifocal ERG is done in cases of Azure, which involves the central part. When the beam of light is passed through the prism, violet color is deflected the most. In patients with aniridia and progressive, the most common cause of progressive corneal scarring is limbal stem cell deficiency. This yes, statement is true. And the first preferred treatment is goniotomy. So you answered 2 correct, 1 wrong. So it makes you plus 15.
So best of luck. Do play.
Thanks.
So with this, I invite our third quiz master for today, that is Dr. Sharmila ma'am. She has been a cornea and glaucoma consultant since 2009 till 2023 in RIO GOH. She is Joint Secretary of Tamil Nadu Ophthalmic Association, immediate past editor of TNOA Journal of Ophthalmic Sciences and Research, member of Cornea Society and Glaucoma Society of India and AIOS. She has actively participated in various PG teaching programs at RIO across the state and in AIOS since past 15 years. She has participated as faculty in many instruction courses. She is the winner of so many quizzes. She is the editor of TNO Journal. She has n number of publications to her credit. She has undergone short-term surgical training courses of simple limbal epithelial transplantation and tuck in tenons patch graft at LVPI Hyderabad. She is a phaco trainer and a keratoplasty trainer. She has special interest in ocular surface and has conducted research and methodology workshops along with the IGU. So welcome you, ma'am.
Thank you so much for the kind words.
So we'll continue with the rapid fire round, ma'am.
Team 7, can you introduce yourself?
Team 7 is Optic Cup.
Hello.
Hello.
Yeah,
go
Optic
ahead.
Cup, can you introduce yourself?
I am Dr. Pooja from Shankarai Hospital, Coimbatore.
I'm Dr. Pratik. We are from second year, ma'am. And our mentor is Dr. Vivek Chaitanya, sir.
Okay. So we do have some acronyms in ophthalmology, not abbreviations. Abbreviations not very, they are not encouraged by teachers, but acronyms you should be knowing. So all these questions will have one acronym too. I just wanted to give you a heads up. Yes, we'll go to the questions now.
So your time starts now.
What is the name of the nystagmus associated with the CP angle tumor?
Pass.
Which anti-VEGF agent was used in VEGF trap study?
Pass.
Expand PAC CXL.
Pass.
Which muscle doesn't originate from the annulus in?
Inferior oblique muscle.
Name of the surgical technique used to treat this lesion. What is the lesion and what is the surgical technique?
OSSM.
And
Yes.
excision,
Come again?
no excision biopsy.
Now, what is the name of the technique? What is the lesion? What is the name of the technique?
OSSM.
Yes. Can we have the answers?
Yes, ma'am.
So the name of the nystagmus associated with CP angle tumor is Brunson nystagmus. So it is a clinical sign. It can give you a clue to diagnose a CP angle tumor. The anti-VEGF agent used in VEGF trap study is aflibercept. You didn't get it right. PAC CXL is photoactivated chromophore for keratitis, corneal cross-linking. The advantage with increasing antimicrobial resistance, this is proved to be a good technique nowadays. And you got the fourth question right. Yes, it's inferior oblique. All the other muscles originate from the annulus in. And you got the lesion right. The lesion is OSN, but you should. The question was the name of the surgical technique, and the name of the surgical technique is Shields. It is Shields technique, that is excision biopsy, along with the remaining steps. So you get one question right, 10 plus 10.
Plus
Can
10.
we give them for OSSN also, sir?
Ma'am, it's up to you. Plus 5?
Yeah, probably. Probably
Okay.
they can take
half the marks.
Yeah.
Okay. So plus 15 for them.
Yes.
Thank you, ma'am.
So the next team is team 8, that is retina rollers.
Retina rulers, can you introduce yourself?
Good evening, ma'am. Myself, Dr.
Good evening.
Nishita. I am Dr. Apsara. We are from AJ Medical College, Mangalore.
And who's your mentor?
Dr. Ajay Kudwa, sir.
Okay. So I hope the rules are clear. The time
Yes.
starts now. Can we have the questions? Who's the father of modern eye banking?
Pass.
Expand GATT. GAT.
Pass.
What causes pseudo-INO?
Pass.
Where do you get roving ring scotoma?
Pass.
What is the most likely location of break in the following picture?
Temporal.
Clock hours.
7 to 11.
That's too wide. Okay. Can we have the answers?
Yes, ma'am.
So I think history is also very important. So you should be knowing about all the history of all the specialties. The father of modern eye banking is Dr. Townley Payton, and the first eye bank was started in New York. In India, it was started in, do you know where it was started in India?
LV Prasad.
In RAOGH. In RAOGH, Chennai. GAT is gonioscopy assisted transluminal trabeculotomy. It is a type of mixed procedure, minimally invasive glaucoma surgery. Myasthenia gravis causes pseudo-INO. And roving ring scotoma is you get it in aphakic spectacles. The most likely location of break in the following picture, according to Linkoff's rule, is 9 o'clock. So you should be knowing all the scenarios in Linkoff's rules. So they don't get anything actually. Better luck with the MCQs. Team 8, team 9.
Team 9 is friends.
Friends. That's my favorite serial as well. Series. So
Hello.
introduce yourself.
Are we visible?
Yeah, you're visible. Please introduce yourself.
I'm Dr. Gaurav Pandey.
And I'm Dr. Sampida Pariyar. We are residents from IMS PHU, and our mentor is Dr. Deepak Ushar sir.
Shall we go to the questions?
Yes, ma'am.
Your time starts now. What is the research drug used to dissolve clump lens proteins in cataract? When doing a recessed resect procedure, which one is done first?
Recess.
Expand DIMS.
Pass.
How did Louis Braille lose his vision? He lost one eye to dash.
Penetrating injury and sympathetic ophthalmia.
What is the finding here?
Melanoma, choroidal melanoma.
Yes, you got 2 right. So let's see the answers.
3 right, basically.
Yeah, they got 3 right. Very good. You got 3 right. So the research drug is lanosterol. You got the resist. You have to resist the muscle first to relax it. DIMS is defocus incorporated multiple segments used in the treatment of myopia. You got that Louis Braille right. He lost one eye to injury and the other eye to sympathetic ophthalmia. And the finding on B scan is a collar stud appearance. It's a classic collar stud appearance seen on B scan in malignant melanoma of choroid where it has breached the choroid. So you got 3 right. Very good. You get 30 points.
Yes.
Thank you, ma'am.
So now team 10 is Iris.
Team 10 Iris, can you introduce yourself?
Video on? Yeah. You're muted, probably. You're muted, both of you.
Team 10. Yeah. Iris, can you unmute yourself? Yeah.
Yeah, now speak. No, we can't hear you. Be a bit louder. Sai, can you help them out?
I don't think they're even talking. They're just looking at something. Iris, can you introduce yourself? They're talking. Can you unmute? Yeah. Yeah, you were muted before. Can you introduce yourself?
Say hello.
No, we can't hear them. Okay. Meanwhile, we can take the next team.
Team 11.
Yeah. Sai, you please help them out.
Yeah.
Team 11 is eye catchers.
So team 11 will be playing the team 10 questions.
Yes.
Yeah, ma'am. Come on, introduce yourself.
Eye
Team
catchers, can you introduce yourself?
Ma'am, are we visible and audible?
Yeah,
Yes.
yeah.
Yes.
Very much.
Good evening, everyone. Myself, Dr. R.P., third year PG. Myself, Dr. Mamta, second year PG. And we are from James Kalburgi, and our mentor is Dr. Ayushari ma'am.
Hello. So shall we start?
Yes, ma'am.
Better be little louder, you know?
Yes, ma'am.
Your time starts now. Who's the famous Indian ophthalmologist who became the sheriff of Nottingham?
Pass.
He's a cornea specialist. Most characteristic type of cataract seen in retinitis pigmentosa patients.
What?
Come again?
Posterior
Expand DWEK.
Pass.
Peripheral palisading is seen in
Limbal stem cells.
what is the etymology? Can you identify the subspecialty with that picture? The etymology, origin of words. So the cornea specialist who became the sheriff of Nottingham is a famous Harmandir Singh Dua. Most characteristic type of cataract, you got that right, that's posterior subcapsular cataract. DWEK is Descemet's tipping without endothelial keratoplasty done for Fuchs endothelial dystrophy. Peripheral palisading is seen in basal cell carcinoma, and etymology is very important. You should be knowing the origin of words of all the subspecialties at least. This is retina, read, net. So you got one right, you get plus 10.
Ma'am, one right, one wrong.
Yeah, one wrong. Yeah, the
Fourth
peripheral.
one. So plus 5.
So plus
Plus
5.
Yes. So with this, we end with the our rapid fire round of the 10 teams. It's time for commercial break. Time to introduce the audience winners of last 3 episodes. That is our preliminary round 8, quarterfinal 1 and quarterfinal 2. Sir, can you please do the honor?
Yeah. So we couldn't earlier announce because there was some problem with the Kahoot and we were not able to share the prize episode winners. So the episode 8 winner is with the this particular identity 8281446417. And number 2 was 9061031036 Jay. And the third winner, the second runner-up in that episode 8 was 8281596669 SAH. So all these winners, please remember you can join in after the complete conclusion of this round for some having some chat. For final 1 winner, PRN, Jay and VKB. And quarterfinal 2, the practitioner category, Jay, KK and GOU. So I request all this episode 8, quarterfinal 1 winner and quarterfinal 2 winner to join us on the Zoom platform at the conclusion of today's episode. Congratulations to each one of you and looking forward to meet you on the Zoom platform following this. Over to you, Shilpi, back.
Yes. Thank you, sir. So now it's section 2, that is again the MCQ round. So please refresh your Zoom screen. So let's start with the section 2. The first question is, the simplest imaging system is a pinhole camera. What is a characteristic feature of this device? Your options are A, high magnification, B, superb depth of field, C, upright image formed at the image plane, and option D, rapid exposure time. Your time starts now. So time is up. Let's see what is the answer. The correct answer is it's because of the superb depth of the field. Now moving on to the second question. A 25-year-old hyperopic patient presents to you for refractive surgery evaluation. You measure a large angle kappa. Otherwise, they are a good candidate for photorefractive keratectomy. What is your plan? Your options are A, center the ablation based on the optical axis. B, center the ablation based on the pupillary axis. C, center the ablation based on the visual axis. And option D, recommend that they continue to use the contact lenses rather than undergoing the refractive surgery. Your time starts now. Now let's see what is the correct answer. Yes, in such patients, you should center the ablation based on the visual axis. Now coming to the third question, 18-year-old woman reports tunnel vision in both eyes. Visual acuity is 20/400. Pupils react briskly. Anterior and posterior segments are normal. She is able to ambulate without difficulty. What finding on Goldman's perimetry would confirm a functional component to her vision loss? So you need to find what is the finding which will confirm the functional component to the loss. Your options are A, overlapping and spiraling isopters, B, central scotomas, C, nasal step, and D, generalized visual field constriction. Your time starts now. Time is up. Let's see what is the answer. So the correct answer is overlapping and spiraling isopters. Moving to the next question. What is the approximate mortality rate for patients with iris melanoma? Your options are A, 4%, B, 15%, C, 30%, and option D, 55%. Your time starts now. Time is up. And the correct answer is option A, that is 4%. Moving to the last question of this subset. A patient reports oscillopsia while chewing. Examination shows reduced voluntary vertical eye movements. What is the most likely cause of these symptoms and findings? Option A, midbrain degeneration. B, Trophima Whipple infection. C, type 1 Chiari malformation. And option D, chronic alcohol intoxication. And your time starts now. Time is up. And the correct answer is option B. So with this, we end with the second set of MCQs and we'll move on to the rapid fire round again. So I again invite Sharmila ma'am for the same. Sharmila ma'am.
Can you hear us, Sharmila ma'am? No, we can't hear you.
Can you hear me now?
Yes.
Yes. Yes.
Okay.
Team Iris, are you able to log in again? Team 10 Iris.
Yes, ma'am. Can you hear us?
Yes. So please introduce yourself.
Team 10 Iris, please introduce yourself.
This is Dr. Barkha. And I'm Dr. Tilotama. We are third year residents from AIMS Raipur, and our mentor is Dr. Ankush.
Okay. So can we have the questions?
Yes.
Your time starts now. Who's the father of modern VR surgery?
Dr. Robert McNamara.
Yes, perfect. How many layers are there in Brooks membrane?
3 layers. 3 layers.
What is Loch Ness phenomenon?
Pass.
Expand drcr.net.
Diabetic retinopathy. Pass.
What is the mode of inheritance of this disease? What is this condition? What is the mode of inheritance?
Pass.
So you got the father of modern VR surgery, right? That's Robert McNamara. How many layers are there in Brooks membrane? You got that wrong. It's 5 layers. Loch Ness phenomena is the loop of vessels and gonioscopy in congenital glaucoma. DRCR.net is Diabetic Retinopathy Clinical Research Network. You just said diabetic retinopathy. What is the mode of inheritance of the disease? What is this condition? It's a macular dystrophy. That's the only autosomal recessive condition. The rest of the conditions are autosomal dominant. So you got 1 right and 1 wrong. So it is 5 marks.
That's fine.
Thank you. Thank you, ma'am.
So the next team is Team 12, that is Arls Triangle.
Yeah, Arls Triangle, can you introduce yourself?
Are you audible?
Yeah, you're audible. Please introduce yourself.
Good evening, ma'am. Myself, Dr. Anjali Sharma. And myself, Dr. Sanskriti. We are from SSMC Riva College, JR3, and our mentor is Dr. Pankaj, sir.
Okay. We'll go to the questions. Your time starts now. Expand SCPA
Pass.
for a corneal condition. Where do you get pie in the sky lesions?
Occipital lesion.
Name 3 tamponading agents used for desmetopexy.
Pass.
Chandler's test is done for.
Pass.
Identify the black shaded portion. Did you give any answer for that?
Black
Did you-
what which portion?
Okay, so the time is up, ma'am. Let's see the answers.
Yeah. So that is selective endothelialectomy for Peters anomaly. Pie in the sky lesions, you got that wrong. It is superior quadrantenopsia and temporal lobe lesions. The three tamponading agents commonly used is air, 100% air, 20% SO6, and 14% C3F8. Chandler's test is done for malignant melanoma, malignant glaucoma. Identify the black shaded portion is superior orbital fissure. So you got only, I think they got -5,
One
right?
ahead. Yes, -5.
-5, bad luck.
So team 13 is Bihar Disha.
Can you introduce yourself?
Yes,
Bihar
ma'am.
Disha. Bihar
Hello.
Disha. Okay.
Yes, ma'am. Hello. Am I audible, ma'am?
Yeah. Your faces are not seen, only the fan is seen. Yeah.
Sir,
Yeah, please.
ma'am, myself Anamka, due to some reason my teammate is absent, ma'am. And I am from PMCH, second year resident, and my mentor is Dr. Sanjeev Kumar, sir.
Is that okay, madam? Can we proceed?
Yes.
Okay, so your questions are: double layer sign and OCT is seen in? Who discovered phakic IOL? What are the orbital implants used in retinoblastoma? Even if you get one right, it's okay. You can pass the question if you don't. What is Eagle study? Can you expand Eagle study?
No.
Next question. Identify the finding in the confocal microscopy. If you don't know, we'll go to them. Can we have the answers, please? No. That's wrong. So double layer sign and OCT is seen in idiopathic polypoidal choroidal vasculopathy. Sir Fudrov actually discovered a phakic IOL. He was a politician as well, so he has many inventions to his name: radial keratotomy and phakic IOL and many other stuff. What are the orbital implants used in retinoblastoma? At least I thought you will name one: acrylic, silicone, and dermis fat graft. Eagle studies effectiveness of early lens extraction for the treatment of angle closure glaucoma. And the confocal microscopy image shows the fungal filaments. So you didn't get anything right. So that's 0. Tough luck. I think that's the.
That's we end with ma'am your rapid fire round.
Yeah, thank you.
Natasha, ma'am.
Yeah, I'm here.
So the next team is team 14. Tulip.
Hello, team 14.
Good evening, everyone. Myself,
Yeah.
Dr. Archana Singh. This is Dr. Priyanka from AIMS Raipur. Our mentor is Dr. Madhuri.
Okay, welcome. And we'll start with your questions. Your time starts now. The most common epithelial tumor of lacrimal gland.
Adenoma.
Which aberration occurs in patients with large or dilated pupils?
Spherical aberration.
3. Femtosecond laser works by a mechanism called?
Pass.
4. Camera corneal inlay corrects presbyopia.
Pass.
Increases or decreases the depth?
Pass.
Gardner syndrome is associated with hypo or hyperplasia of
Hypertrophy.
What?
Let's go.
Hyperplasia.
Okay, and what about fourth you answered?
You want to go back to the fourth?
Third, ma'am, third we answered refract. Next, I answered second.
Second you answered, third was pass, fourth you answered. What you said about fourth?
No. Fourth they passed.
Okay.
So the answer is the most common epithelial tumor they got right, pleomorphic adenoma. Aberration they got it right, spherical. Femtosecond laser works by photodisruption.
the camera corneal inlay increases the depth of field, and Gardner syndrome is associated with hyperplasia. So that is 3 out of 5.
Yes, plus 30. So good.
Thank you, ma'am.
I think there is one negative mark, the photo disruption one.
No,
You have to
no,
answer some.
someone
He said
passed.
pass for that.
All right, okay. Next, we'll go to team 15.
Blossom.
Hello.
Team.
Good evening, ma'am.
We can't see you. Yes.
Good evening, ma'am. I'm Dr. Pooja. I, Dr. Gitanjali. We are second year resident from GMC Bhopal.
Okay, welcome. Let's start with your questions. The gland associated with hordeolum externum.
Meibomian gland.
Next question. 1 diopter difference will cause magnification of?
Pass.
Question number 3. Which keratoplasty works by radio frequency shrinkage of collagen lamellae in the cornea? 4. Ocular albinism is associated with an abnormally high number or low number of crossed fibers in the optic chiasm.
Pass.
And 5th question is the common primary benign tumors of the orbit in children. Common primary benign tumor in the orbit in children. You want to attempt any of the questions that you passed? Okay, we'll go to the answers. The gland is wrong, so it is eyes or more. And 1 diopter causes 3% magnification. The keratoplasty that works by radio frequency shrinkage is conductive keratoplasty. Ocular albinism has an abnormally high number of crossed fibers. And one of the common primary benign tumor in children in the orbit is capillary infantile hemangiomas. So that is, I think, -5 probably.
Yes.
Luck. Better luck next time.
The team 16 is Iris Beats.
Good evening, ma'am.
Yes.
I'm Dr. Alfia. I'm Dr. Radhika. We are from Amrita Institute of Medical Science, and our mentor is Dr. Gopal S. Pillai.
Okay, let's go to your questions. So the gland associated with hordeolum internum.
Meibomian gland.
Spots seen in the fundus in vitamin A deficiency.
Whiteout spots. White.
What is that? Which contact lenses are the gold standard for correction of reduced vision due to ectasia?
Pass. Pass.
Fully human monoclonal immunoglobulin antibody directed against TNF alpha is the US FDA approved medication for non-infectious uveitis. Upper eyelid blepharoplasty, an ophthalmologist identifies the peripheral arterial arcade. Where has he dissected down to? Which structure? You want to attempt any of the questions that you passed?
What you said for the second?
Whiteout spots.
Okay.
Okay, so we'll go to the answers. The gland associated, they got right. That is meibomian. Spots in the fundus is called Weimura spots. Which contact lenses? It is the RGP contact lenses. The fully human monoclonal immunoglobulin used in uveitis is adalimumab. And during upper eyelid blepharoplasty, if you see the peripheral arterial arcade, you have to go up to the Muller muscle.
So
they just get one right and one wrong.
+5.
Okay, right. Let's go to the next team.
Next team is team 17, Eye for Eye. Have you joined team 17? I don't think, ma'am, they have joined. So the next team is team 18, SM, MCH and RI.
Good evening, sir. Good evening, ma'am.
Yeah, good evening. So, do we just do the Team 17's questions or are we going to Team 18?
Team 17 questions.
Okay.
Please
Yes,
introduce
yourself.
I'm Dr. Bhanumati from Muthukumaran Medical College, ma'am.
I'm Hinduja from Muthukumaran Medical College, ma'am, second year postgraduate. Our mentor is Ramya Ravindran.
Your voice is echoing.
Are there two devices there?
No, sir, only one device. Sir.
Only one device, sir.
Okay, fine. Go ahead.
Go to your questions. Shield cataract is seen in which condition?
Allergic conjunctivitis.
Microaneurysms are seen in which layer of the retina?
Retinal nerve fiber layer.
The camera inlay uses what central aperture to produce a pinhole effect and increase the depth of field? What is the size of the aperture?
Pass.
Most common cause of secondary open angle glaucoma?
Phacolytic.
The impulse control disorder seen in teenage girls characterized by repeated desire to pull out hair, frequently eyebrows and eyelashes.
Try.
You want to attempt any of the questions that you missed? You can go back and check again.
Second question, how to flex it on the
Time is up.
Okay, let's go to the
Trichomania.
answer. So shield cataract is seen in atopic dermatitis. Microaneurysms are seen in the inner nuclear layer. The camera inlay uses a 1.6 millimeter aperture. The most common cause of secondary open angle glaucoma is pseudoexfoliation, and the condition that is seen in teenage girls that causes them to pull out their hair is trichotillomania. So I think they have nothing right, and they have two wrong.
Correct. Minus 50. 3 incorrect. Yeah.
3 wrong actually.
Okay.
Okay, better luck next time.
Team Luminous. Team Luminous and Team SDM. Have you joined?
I don't think we are.
No. Team 19, that is Luminous, and Team SDM. I don't think so. We are end with this because 3 teams haven't joined.
All right. Okay. Thank you.
We are left with the last set of MCQs. Sharmila ma'am?
Yes, ma'am.
So, shall we start with the last set?
Yeah. So your time starts now. A middle-aged, healthy male presents with metamorphopsia. His anterior segment is quiet. The posterior segment shows unremarkable vitreous with multiple old chorioatrophic scars. Your diagnosis. The timer is working.
Ma'am, time will start after the option.
Toxoplasmosis. CHRPE. Is it presumed ocular histoplasmosis syndrome or tuberculosis? Time's up. So your answer is presumed ocular histoplasmosis syndrome. So the clue here is the posterior segment shows unremarkable vitreous, and it's not toxoplasmosis retinochoroiditis, and it isn't the other CHRP or tuberculosis as well. Next question. Identify the instrument and the procedure. What is this instrument? Is it a trabectome? Is it a Zen implant? Is it a Cahook dual blade? Or is it an eye stent? Can we have the answer? So all are actually minimally invasive glaucoma surgery. So that's a Kahook dual blade, which has become very popular in India because of the cost. The rest of them are pretty expensive, and this has become very popular in India. All are minimally invasive glaucoma surgeries. Next question. So identify the first generation autofocal IOL, which has been called the world's first IOL with artificial intelligence. Is it Helena, Olina, Elansa, or Sapphire? Your time starts. So the answer is Elansa. So this is the first IOL created with artificial intelligence, and it's electronically it can be adjusted. The autofocus can be adjusted according to the pupillary size, pupillary diameter. What is the clinical finding? It's a textbook picture. Which drug has to be added for this patient? Oriconazole, levofloxacin, PHMB, or lenazole? Your time starts. And the answer is linezolid. So this is a case of pythium keratitis, which actually worsens with oriconazole. So the clue here is the pinpoint infiltrates and the peripheral gutter. So this is a classic textbook description given in payment by Prajna sir. So it's pythium keratitis, and the drug that we add is linezolid. Joseph Pulitzer is famous for posthumously establishing the Pulitzer Prize. Which disease did he go blind by the age of 42? Diabetic retinopathy, retinal detachment, corneal ulcer, or optic neuropathy? What did he have? The trivia is also important. So the answer is retinal detachment. So he went blind by the age of 42 with retinal detachment because of retinal detachment.
Okay. With this, we end with the MCQ round also.
Thank you, Dr. Shilpi.
SPM team has joined. Sai, can we, take them online?
Doing it, ma'am.
Okay.
So where were they till now?
They have joined with a fancy name without the team name.
Okay, so they have MCQ this round. Rapid fire is left, no, for them?
Yes.
Okay. Dr. Sharmila will have to do one more honor.
Natasha, ma'am.
Okay, Natasha madam has excused herself. She had to leave for an emergency.
Okay.
Sharmila can do that. Or you can do it, whatever you feel.
Probably Dr. Shilpi can do it. I'm not aware of the questions.
Okay. Okay. Sai, have they joined?
Not able to find them, madam. I'm trying to.
Are we ready for with the set of questions for them?
Yes, sir.
I think they're there.
Please unmute yourself.
Hello, good evening. I'm Dr. Spurti. Dr. Shilpa. We are from STM Karnataka, and our mentor is Dr. Rupa.
Okay, fine. Welcome. You should have labeled your team properly. No issues.
Yeah.
Now go on. Dr. Shilpi?
Yes, sir. So we'll start with the rapid fire round. Okay, so it's team 20. Yes, right? SDM team.
Yes.
Okay. So your 30 seconds starts now. Drug causing only mydriasis with no cycloplegia.
Phenylethylamine.
Earliest sign of RP on ERG.
Absent A sign, A amplitude.
Condition in which axial length less than 20 millimeter and ratio of lens volume to eye volume is higher than the normal.
Pass.
Case following PRK typically peaks dash month after the surgery.
Pass. Pass.
In 1-year-old boy, what corneal diameter measurement should trigger concern for glaucoma?
11 mm.
What?
11 mm. More than 11 mm.
Let's see what are the answers. So the first you answered correct, that is phenylephrine. Second also you answered correct, that is delayed A wave. The third is the condition is called nanophthalmos. Is following PRK, it typically peaks 1 to 2 months after the surgery. And 11 millimeter is the normal diameter. So if it is greater than 12.5, then it should be a cause of concern. So this is minus. So you answered 2 correct, 1 wrong. So it totals to plus 15. Any other team? Team Eye for Eye and Luminous? Okay, so we are
I think
through.
we are at the conclusion. Okay. Can I request all the mentors who are there to log in with us for a small chat, as well as the winners of the last 3 episodes rather, I should say. Can we have them with us? Dr. Deepak Mishra, I see him. He's the mentor of one of the teams which played quarterfinal 3. Dr. Deepak.
Good evening, sir.
Hello,
Welcome,
sir.
Dr. Deepak.
What's going on, Dr. Sharmila? You are a really tough quiz master, no?
I'm good, sir. Nice to see you mentoring.
Dr.
The
Soumya,
usual mentors.
ma'am. Dr. Soumya, ma'am, can you just come on the screen?
Sir, good evening, sir.
Ma'am, we
welcome.
see you.
We can't see you. Unmute yourself. Get your video as well on. Your team played really well today.
Yeah, thank you, sir. Thank you so much.
Good, good, good. Thank you for being there and watching your team. It shows your commitment to your students. Great.
Thank you so much, sir.
Dr. Deepak, you can also get your video on.
Yes, sir. This video is on. My photo is there.
We want to see
See the live Dr. Deepak Mishra member ARC.
He's going to contest in the elections, I think, sir. Such a big one.
खुद के पोस्टर के सामने खड़े हो गए सर.
अब मैं आपसे कुछ सीख रहा हूँ, डॉक्टर शिल्पी, हाउ टू मेक सम photos so that I can also not win, at least qualify for some international award.
Yeah, Dr. Sharmila, just to share, our Shilpi had ASCRS.
Yes, sir. I just congratulated Dr. Shilpi. That's really amazing.
Yeah.
I think it's first time, sir, that any single person can own 4 awards.
Yeah, amazing. Both of you are amazing. And we have one from our state, Dr. Prasanna.
Yeah. Yes, keeps on doing. We are just learning from all these people. Youngsters are inspiring us to do more.
Amazing, sir.
Sir, I am also young.
Yeah. You get bracketed with me, so unfortunately, people might be looking at you in the other way around. Okay, Sai, do we have any of the participants of the last quiz with us, or any other mentors with us today?
Dr. Ramya, are you there?
Dr. Dhanya,
We
Dr.
ask the mentors how were the questions.
Yeah, Doctor, we can have some comments. I can't say to anything to our quiz masters. They really work hard for making this brain teaser so successful. So
Thank
Deepak,
you,
how
sir.
was your experience today?
Sir, it's really we can say one of the best question sets I have saw. I have seen many of the episodes of the Quiz Masters of your
Thank you.
brain teacher, but this is the one which I really like it. And truly speaking, for all the participants, don't be disheartened because most of the questions, even at the level of mentors, we are also confused that whether it is true or not, or what are the things there. And you are just able to do or perform so well just because you are bubbling with the knowledge, and we are out of touch with the books and other things. So that is the best part, that all of you are here. And the more important is this important initiative is started by the Baunkule sir. Means at least you know not only the standard of your college but the another college, and even you are exposed to such a beautiful mentors are the quiz masters. You have to face same type of clinical scenarios or problem one day in your life. But as early you learn or face them, that is best for you. That is the only thing I can say.
Thank you, Dr. Deepak. But be it, I always remember, don't take it wrongly, Dr. Sharmila, but Sharmila is a very tough teacher.
सर
No,
मुझे भी
sir.
क्वेश्चंस नहीं आ रहे थे इसलिए मैंने बोल दिया.
I'm just pulling her, but she really did a wonderful job. I know every one of them did a
Thank you.
wonderful job.
Thank you, sir.
She even did wonderful job as an editor too. I remember at her time, the
editor.
her journal
Thank you. That's very kind of you,
is
sir.
so much.
So I just wanted to mix everything, history, trivia, everything together. So
It was well balanced for all the teams. That was important. That
Yes,
is
yes.
important for us. Okay.
Thank you, sir.
Shilpi, do we have any participants of the last time?
Sai?
I don't think so, ma'am.
Okay.
Okay, fine. So I think we can then wind up the today's episode.
Yes.
Okay. So thank you
Thanks
once
to
more, all the
thank you, sir. Thank you for this amazing session.
I
Thank
think
you.
there
You
is
and
one
Dr. Shilpi are doing an amazing job.
Oh, all credit goes to you people who formulate such questions. Our job is to collate all those things, get you all together on a single platform. And that's what the platform is raising its bar every day, every year. Thank you for being with us. Thank you, all the participants. Again, we will be meeting after 2 weeks for quarterfinal 4. And the date is, Shilpi, that exact?
24th of April.
24th of April. And after that, we will start with our 2 semi-finals and 1 finals. So it's time for us to say bye-bye till then. Okay. Thank you once more, Sharmila
Thank you,
ma'am.
sir. Thank you, sir.
Bye bye, sir. Good night.
Wish you all the best and a speedy recovery for your family member. Take care. Thank you. Thank you all the
Thank you,
members.
sir.
Thank you. डॉक्टर शिल्पी नेक्स्ट टाइम मेरा भी नाम ऐड कर दीजिएगा.
बिल्कुल सर, बिल्कुल.
Next time, I'm going to sit with Dr. Shilpi for All India Quiz. She must be knowing a lot of answers for the All India Quiz. Thank
No,
you.
I'm
Bye-bye.
not for the master. For another thing. What the papers or the posters or images she are sending abroad.
Okay, I thought you were asking for quiz master.
No,
Okay.
no, not for
Thank
quiz
you.
master.
Okay. Definitely. Yes.
Chalo.
Bye,
Chalo,
sir.
bye-bye.
कल मिलते हैं सर. कल अपना.
Deepak, I will call you in a minute.
Okay, sir. Bye,
Okay,
sir.
bye-bye.
Bye.